So my project is about developing an intimacy and sex therapy tool for people who've had head and neck cancer. So if you've had prostate cancer or gynae cancer, there's lots of tools to help people with sexual function and intimacy afterwards, but there isn't anything for head and neck. And head and neck's on the increase. We've got about 30% increase in head and neck cancer of 30, 40-year-olds, and that's because of the HPV virus. So girls are immunised at the moment, but boys aren't. So there's 30% of head and neck cancers we could eradicate. But it means at this moment in time, we've got a lot of young people having extensive surgery to their tongues, their jaws, their lips, to their oral cavity, and maybe reconstructed, or they're having 7 weeks of chemotherapy and radiotherapy to their oral cavity. So sexual function afterwards, so the issue around, are you able to give oral pleasure to your partner? Can you get lip seal to enjoy a kiss with your partner? Are all things that are coming to the forefront because we've got a very different population in head and neck now. So I've been a head and neck nurse prior to the job I'm in now for 13 years and recognised that we had this problem. So I trained as a psychosexual therapist in my own time, and then delivered sex therapy sessions for head and neck cancer patients. And from that I realised that it can't just be me who delivers this. I'm one person. Yes, I'm a sex therapist and I'm a cancer specialist, but we need to be able to offer this to other people. So this was about saying we need a tool that enables patients to have the door opened to say you can ask these questions, a tool to help professionals to identify what problems people have got, because we can resolve some of those problems. So things like people don't realise if you prescribe opioids, even codeine, it can reduce your libido. We tell people they get constipated, but we don't say it could reduce your libido, and that could be really important to people. So there's lots of things we can simply do. That doesn't mean to say you need to be a sex therapist, but we need to open the door for conversation and maybe have hints and tips for people on what to do. So I've designed a tool with 2 colleagues. We're trialling it at the moment. It's on a cross-sectional study of 200 people. And then I'm putting an educational package between each question. Is a self-help of what you can do. Different lubricants, because the mouth is dry, it's got no saliva, that doesn't cause thrush for the head and neck patients. The mouth is comfortable and intimacy is more pleasurable, just as one example. And I'm hoping to make that into an app as well, so it's available for anybody of all cancer sites, because whilst this is for head and neck people, actually the issues are common to all cancer patients, and there's very little out there. So sometimes people want the door opening and a health professional to help them, and sometimes want the door opening but being directed to where they can go themselves. So I'm hoping that our intimacy tool will go nationwide as well as internationally, but there'll be an educational tool behind it. So that's what my research is. If my project was chosen as a winner, I'd be absolutely delighted. It would mean the world, because head and neck cancer was my speciality for 13 years. I really wanted to make a difference to patients, and this tool does that. So winning kind of means that rare cancer gets a voice,